pleasure to present the Crump People Awards for Fall 2010. These awards were created to honor those who give an extra effort, who excel at what they do, and who help to make UNC Health Care a caring and productive and efficient place. The people chosen to win this quarter's Plus People's Award exemplify their commitment to caring in everything they do. Our first recipient is Judy Melton. Judy is an Office Support Assistant 3 in the Revenue Management Department. During a 3-week period this summer, Judy found herself the only employee in her department, yet managed to keep things running seamlessly. Without complaint, she rolled up her sleeves and accepted the challenge to learn new tasks and deliver the same high level of service her customers would come to expect from a fully staffed office. Judy, we thank you for everything you do. Our next recipient is Timothy Byrd, a business analyst in the Affiliate Accounting Department. As our Lawson guru, Tim is always willing to go out of his way to help with any Lawson implementation issues. Maintaining a pleasant and upbeat demeanor, Tim is quick to provide information and solutions about the Lawson system. He goes above and beyond the call of duty on a daily basis by ensuring that we are the best we can be, utilizing the assets we have at our disposal. Tim shares his times and knowledge to teach his coworkers how they can look up information in the system more efficiently and easily. Tim, we thank you. Our next recipient is Missy Beckwith, a nurse in our bone marrow transplant unit. From day one in her unit more than 3 years ago, Missy has radiated kindness and care not only for her patients, but for all those with whom she comes in contact. Missy not only cares for her patients' physical well-being, but also for their emotional well-being by spending her downtime talking with her patients and their caregivers. Her quiet demeanor allows her to be honest and direct with her response to any questions. We thank you for everything you do, Missy. Our next recipient is Barbara Leshney, a nurse on the 5th floor of the Children's Hospital. Since joining her unit, Barbara has served as a role model for how to build a sense of family between the staff, patients, and their families. Barbara has done this by planning events that lift the patients' and family spirits and recognize her coworkers for their efforts. Her demonstrated level of patience and compassionate care for her patients, particularly those with lengthy hospital stays, is one we should all try to emulate. Barbara, we thank you for everything you do. Next is Melisa Witzke, a clinical nurse in our emergency department. Melissa is constantly recognized by her department for her positive attitude and outlook she has every day. Known for her calm demeanor and bringing order to the chaos of the ED environment, she goes out of her way to help any and all coworkers. As a role model nurse in her department, Melissa goes that extra mile to make sure that the patients and their families are kept informed and provided the best possible care during some of the most stressful times of their lives. Melissa, we thank you for everything you do. Our next recipient is Matthew Cox, Health Unit Coordinator in the Pediatric Intensive Care Unit. All those who work with Matt would readily agree that he is an expert at ensuring the PICU runs smoothly and effortlessly. As a self-motivated employee, Matt identifies and solves problems with a quick efficiency. Even during the busiest of shifts, Matt remains calm and organized and is responsive to the needs of his team members through his diligent manner. His awareness of the unit's needs allow him to react even before anything is asked of him. We thank you for everything you do, Matt. Our next recipient is Charlene Durham with McLendon Clinical Labs. Her consistency at work translates into her commitment to her teams and patients by maintaining an effective personal and professional plan. Charlene is one of the few technologists that really understand lean processes and does not only use them consistently, but these processes in the CPA, and encourages other technologists by explaining why the processes are important. Her hard work and dedication have allowed her team to be less stressed and has streamlined their work. We thank you for everything you do, Charlene. Our next recipient is Tammy Ware, an oncology patient coordinator. On a daily basis, Tammy demonstrates teamwork and kindness towards patients and staff, often stepping in when coworkers are out of the office. Tammy's responsibilities require multitasking and extensive communication for a high-volume disease specialty, all which she does with ease and efficiency. Recently, her department received a thank you letter from a patient commending Tammy, specifically for her promptness and respectfulness. We thank you for everything you do, Tammy. recipient is Bruce Jones, a traffic officer with the UNC Hospital's Police Department. Bruce is proactive in his traffic control tasks, assisting motorists and pedestrians in locating their destinations, aiding in the loading and unloading of patients and visitors, directing motorists to appropriate traffic lanes, and controlling traffic while pedestrians safely access crosswalks. His kind and caring demeanor, along with his sure and steady patient handling skills, have been true assets during tough and emotionally draining calls that can involve placing a patient into restraints. Bruce, we thank you for everything you do. Our next recipient is Juan Trujillo, a financial counselor for the Ophthalmology Clinic. Juan's work ethic, integrity, and professionalism have truly raised the bar within the Ophthalmology Clinic's operations. He has demonstrated stellar performance in the financial arena of goal setting and ensuring the patients of UNC Health Care have a clear understanding of the expected payment due at the time of service. Without breaking his smile, Juan often assists the front desk with translations or helpful information. We thank you for everything you do, Juan. Our next recipient is Beverly Crump, an OR pharmacy technician. As a perfectionist, honest, and empathetic person, Beverly will always go the extra mile to give the best care to her patients. She is an employee that would sacrifice her priorities if she can offer any help to others, often staying extra hours to help out coworkers. As a person who does not fear change, she is often suggesting new initiatives for improvement in her department, both to improve patient care and to decrease waste while increasing efficiency at work. Beverly, we thank you for all you do. Although he's not able to be with us this morning, our next recipient is Christian Michael Plesh, a senior application system analyst programmer in the Information Services Department. Aware of the impact his work has on the overall operation of the health system, Mike always strives to deliver high-quality integration solutions. Interacting with almost every team within ISD, Mike often volunteers to help others by developing systems that support their projects. Exceptionally responsive and one of the most trusted sources of accurate information in ISD, he often has a continuous line at his desk of people looking for help and guidance. We thank Mike and hope that you will extend that to him when you see him. Our next recipient is Alyssa Collins-Yoder, a clinical nurse 3 in the Surgical Services Department. Alyssa displays an outstanding capability to lead the department through a constantly changing yet consistently busy pace. She is very personable and extends herself to fellow staff to make a cohesive and high-functioning team. Her honesty in assessing the department's strengths and coaching her co-workers while correcting their weaknesses is invaluable as they strive for excellence in a patient's recovery experience. We thank you for everything you do, Alyssa. And our final recipient today is Elizabeth Speck, a surgery resident and treasurer of the House Staff Council. She is compassionate, reliable, trustworthy, and professional, while constantly striving to better her advancement as a physician and surgeon. Karen has been an invaluable asset to medical student training and instruction, serving as a preceptor in many, if not all, of the skills sessions while she was in the lab. Her concern for a balance of resident well-being and satisfactory training in general surgery have allowed her to suggest improvement measures in her department. Dr. Speck, we thank you for everything you do.